Hello everyone. Good afternoon. My name is Christine Maytalang and I'm from BSN2 of Our Lady of Mount Carmel. And today I'm going to do a return demonstration on a proper way of doing a newborn screening. Okay, so of course newborn screening is very important or very vital for a newborn, especially because this kind of screening will help us identify any conditions that will have an impact or that will affect the newborn long term, or it may affect his survival. So the first thing we'll have to do is, of course, once we come to the room, we introduce ourselves to the patient, especially the parents, and at the same time we verify the patient's identity. So in this case, hi, my name is Christine. I'll be your student nurse for today. I believe I'm with baby De Leon, so you can check. And then at the same time, you go ahead and explain to the parents what is to be done, and at the same time, why is it needed to be done, and at the same time, the things that they can do for them to help us make this process successfully. So after doing so, we go ahead and prepare all of our equipments. Some of the equipments that will be important for us to have is, of course, the clean gloves, micro lancet, the one that we're going to be using for piercing, cotton balls, both with a 70% isopropyl alcohol and a dry cotton balls. We will also be needing, of course, a canister where we can put our discard our soiled cotton balls. Okay, and very important is, of course, the filter card that we are going to use for the blood sample of the infant. Okay, so after that, after we go ahead and we prepare all of our equipment, it's time for us to complete all the necessary information in the filter card. Okay, so we have just to fill it out with all the important demographic information. And then after we completed the demographic information, we go ahead and perform hand hygiene. Okay, and of course observe all necessary infection protocol. So let me go ahead and do hand washing real quick. Alright, so hi, I'm back. So I'm done doing hand washing. Of course, the next thing we'll have to do is to don on clean gloves. So let me just do it quickly. So after we've done on our clean gloves, we go ahead and check the patient's identity. So we can do that by, of course, checking the tag, okay, or we can also verify that again with the parents. Okay, so after we check the patient's identity, we have to grasp the lower leg of the infant and at the same time the feet, okay, for us to be able to impede the venous return slightly. After that, we go ahead and clean the lateral heel using using a cotton ball with a 7% isopropyl alcohol. So we go ahead and rub it vigorously. Okay. So after we've done that, of course you have to wipe it with a dry cotton balls. Okay. So after we dry the site, so the next thing we'll have to do is to check, okay, or to look for an unpunctured site where we can do the newborn pricking or the newborn screening pricking. Okay, so after that, after we've chosen an unpunctured site, it's now time for us to do it quickly, okay, but of course gentle. All right. So let's go ahead and do some pricking. Let's just pretend that this is a micro lancet. We do it on the lateral heel of the newborn. Okay, so after we prick it, the next thing we'll have to do is just to wipe it with a dry cotton balls. The first blood will be wiped with a dry cotton balls. Okay, and then after that, we go ahead and wipe it on a filter card. 1, 2, 3, 4, 5. So 5. We blowed it on the filter card, and after that we go ahead and cover or we go ahead and of course cover or to wipe the blood or cover the puncture site with the dry cotton balls, put some pressure on it until the bleeding stops. Okay, so once the bleeding stops, the next thing we'll have to do, of course, is to discard all of our equipment, all soiled cotton balls. We also, of course, remove our clean gloves. Okay, and of course, discard it as well. Okay, and at the same time, perform hand washing. Okay, so after we perform hand washing, then we document what happened during the procedure, and of course what happened or the result of the procedure. So that's it for the newborn screening. I hope you've learned something. Thank you so much, and you all have a great day. Bye.